I've had 2 different chest ports over the past 14 years for Lyme treatments, and both of the experiences were entirely different. Getting them put in was different, getting them taken out was different, and the way that I accessed them was different. The first time that, and by the way, this is my chest port, my last one that I had. So I'll show you where this went. This is my scars, which in this light you can't really see them that much, but they're definitely there. There's 2 there. It basically sat right here, and it would go up into my neck right here. I have like tiny little scars there from putting it in, and then it goes back down towards your heart. So that's where it goes in the body. It is different than a I can't think of what it's called at the moment, in your arm. That's like a tube that's open. This is sealed under your skin, and the needle just pokes through your skin and goes right into this, and then you can get infusions without having to be poked every time. So that's the benefit of having these. So the first time that I had this was in 2009, right after I was diagnosed with Lyme disease. And I went and started seeing a Lyme doctor who put me on first oral medications, then injectables, and then we went into IVs pretty quickly because I wasn't tolerating the oral or the injectables very well. And so the first round I had it put in, I go to this doctor who's associated with the Lyme doctor, and all of his patients went there, I believe. It was very early on in Lyme being just treated around the world in general. There wasn't much information about it. There wasn't a lot of options or anything like that. So it went to this guy. I go in, they gave me like a Valium, and that's it. And I'm all nervous, of course. I'm, having I have no idea what's going on. I don't know what to expect or anything. It's very rushed, and I didn't feel like I was being like treated like very well or anything. And I spoke with other people who were there on this day as well, and they had even worse experiences than I did. So I go in, and they basically, this isn't to scare anybody. There's a whole bunch of different ways that you can do this, and now your doctor is going to talk to you more about it, and you can be more informed after hearing this to make sure that you ask the questions. So I'm not saying this to scare you if you are going to be going in to get your port put in or taken out. Just communicate with your doctors. It'll be okay. This is what happened the first time around. So this was in 2009. Again, I just want to repeat that. So I go in, and they're back-to-back appointments. Like every half an hour, they were doing another patient for this. And they basically just gave me the Valium, and they just told me to turn my head. I was fully awake, and yeah, it was really, really bad. It hurt for sure. I mean, they're cutting open, putting this under your skin and threading it through your veins. So I find out after I get this put in and before I get it taken out, so I had to go back to this doctor when I did get it taken out, that this other girl that I knew, she had been in there like the same day as me or the day before me or something, and they actually threaded it wrong into her. And if she would have had her port access, if they would have done infusions through her port, she would have died. So she like couldn't breathe right. She was having problems. She had to like fight with them and like super advocate for herself and tell them that something is not right. So they took her back under, they put her under the scanner. They use like a scanner to see internally like where they're putting it. And they're like, oh my God, we need to get this out right away. So they obviously took it out. It was going into her heart. So advocate for yourself. Know when something doesn't feel right and trust your instincts. My experience while I had that first port in was that I had a nurse come to the house, and she would access my port every week. And then she And then once it was accessed, there was like a tube that would be hanging out of it. And then that would be really easy to go in and out. So you don't have to poke it with a needle every day. It's already there. It's just that you can't shower or anything during the time that it's in there for that week. So I could take it out myself, but she would come in and put it in. And I had a lot of fear around this. It hurt. It feels like just like a constant, really, really bad bruise there. And like, just especially like the first couple months after getting it done. So that was my first experience, was that I had it in for, I think, about 5 months before I got it taken out. I used it for 5 weeks of IV infusions until I had I wasn't detoxing enough, and I ended up having a severe gallbladder infection and having my gallbladder removed. And that was the end of that treatment. So I had it in for, after those 5 weeks, I left it in for a while, and then decided to just get it taken out, which most people get it taken out after treatment. My second time around was very different. How did I get it put in? I'm trying to remember now. They put me under almost all the way for the second one. So it was like a breeze. Like I went into the facility. It was in Arizona. It was an entirely different experience. It was an actual hospital. This first one was just like a private small practice of like this, basically this mill of getting your port put in. The second one was in a hospital, and it was, they prepped you, they were nice to you, they gave you warm blankets, they like explained absolutely everything, even went over like different ports to be put in and what would fit best with my body. And then I didn't feel anything. I was kept just going in and out of sleep. So it was super easy. I was able to access it, I believe, the next day for the first time, and I started treatment. That port I had in for over 5 years. That's a long time. Some people have it in for up to a decade. I think like what the recommendation is to not have it in for more than 5 years. I didn't have any problems with this one. It would hurt every once in a while when I would move, or I still get some pains and stuff like that randomly in that area because it was something here that I had for over 5 years, and then plus the first time that I had it as well. So this time around was really easy. Sometimes people have, my sister had chemo treatment last year, and hers actually like twisted, and I've heard of that happen before too. She has a different shape, she has larger breasts, and then that makes it harder for it to stay in place. I do not have that problem, and so it just kind of hung out there and was very visible. It would poke through my skin. I'll put some pictures on here. It made it just really easy to access, and not everybody has that. I also didn't have problems with them when they were trying to access it with getting a blood return, which means that first they pull the blood out before they push anything in, and just make sure that is flowing properly. And I just didn't have problems with it. It was so easy. I used this port for Lyme treatments of various different IVs, of natural antibiotics, of erythromycin, and Restefin, and various different vitamin bags and stuff like that I had for solidly for 15 weeks. It was like 5 days a week. And then I had another second treatment done like a year and a half after that or something close to that, and that wasn't as long. And then I would use it just periodically when I needed to, if I needed to get a blood draw or something like that, if they were a facility that could do that. I have small veins. It's very hard to poke me, and when I was really not feeling well, it was extra hard to get veins. So I would be poked about 3 times at least each visit before they could find something, and so it just made it easier if there was a facility that had access to accessing my port. Another thing with the port being in for that long is if you're not using it, you do have to go get it flushed. They say every 4 weeks. Again, my port was just super easy. It never had a problem. I could stretch it to 8 weeks and go get it flushed. And basically you just go in, they do a blood return, they pull it, they see the blood's coming out, they flush some saline through it, and then they pull the needle out, and that's it. So it was real easy. It would only take about like 20 minutes or so. The biggest thing that I noticed with having it in was that like the seatbelt in the passenger seat goes right across there. And so that would always hurt. So I would often pull my seatbelt down here, and that would help. But that was like one of the biggest things. Again, I would get like the shocks of pain. My sister also had that. I've heard other people talk about this as well, is that like you just randomly get this like shooting pain that goes like anywhere from like down here. And sometimes people get it down their arms. I really just had it like here. It feels like burning, tugging, pulling. And I still get it now that it's out. It's happening less and less. I got this one here taken out in February of last year. So it was right before COVID had hit. I was going in and getting it done. I'll put some pictures right here of me sitting in the office. My mom actually took these pictures because I was sitting there in the light and I was tolerating the light in the room without having my sunglasses on, and I didn't even realize it. And that was a really big moment too. I am sitting in front of a ring light right now. I've mentioned this in prior videos. Light sensitivity was extreme, and I could not be in a room with bright light. And I would put a hood on, I would cover my eyes, I would sit there with my hands over my eyes, I would have sunglasses on, noise canceling headphones. So I'm sitting there that day, there was music on, I believe, and we're just hanging out, and it wasn't a big deal. So that second time that I got my port taken out, was another experience. It was a different variation of a way that you can get your port put in or out. So I chose to do it in the office without any sedation, and I believe I took a diazepam beforehand, and I just decided to suck it up and to just lay there and get it taken out. Basically, I went into the appointment and the guy was really nice. He was just like, all right, well, here's the thing. I can do it now in about 20 minutes, or we can schedule this in about 2 weeks out, and we can put you under all the way. We can just sedate you a little bit. He's like, we're gonna have to do an outpatient admittance, and like, so I was like, yeah, just do it now. Let's just get it done with. I don't even have time to think about it if it's happening this quickly. So if you don't want to see, here is a picture of what the casing around the port looked like. So when you get any foreign object in your body protects it by putting this casing around it. If you heard anything about breast implants and casings, this is a miniature version of what a breast implant casing would look like. This is a very healthy one. It is pink, had no infection, it had no toxins in it. Sometimes they're yellow and brownish and spots, or all these different things, and I was very fortunate, and they were able to cut out most of the casings, but you want to get most of the casing cut out because it can hold heavy metals and toxins in it. So if they can get it out, it's always awesome if that's the case. And he was doing this obviously without any, I think he did some local anesthetic around there, just like what you would get when you go to the dentist and they put it in your mouth. And so that's all it was the local stuff. And it definitely hurt. You could definitely feel him pulling and tugging. It was a lot of sharp and burning, and you could feel the scalpel going in and everything like that. But you know what? I got it done with so fast. I mean, he was done in, I believe, like 20 minutes, if that, like completely from start to finish and stitching it up. Like it was very, very quick. So yeah, definitely lots of different experiences that I had with the port. And it really did make life easier. There's no way I could have had my treatments done without having a chest port, especially when you're accessing your veins 5 days a week for 15 weeks in a row. There's just no way. So that is my experience with a port. I'm definitely glad that I had them. I'm definitely glad that I know more about it and I was able to advocate for myself the second time around. Let me know down below what your experiences are with ports, if you've had any, if you've had any complications. Yeah, just let me know about it. PICC line, that's what the one in the arm is called. It's a PICC line. If you've had a PICC line versus a port, I know a lot of people have had both. Which one did you like better? And let me know if you have any video suggestions. I would love to hear them and make some videos for you guys. Give me a like, and I will see you guys in the next video. Bye!